Hello, my name is Nathan Wiltshire. I'm excited to share my research with you today, exploring the experiences of young adults during the first wave of the COVID-19 pandemic in Australia. In this presentation, I'll cover some background to the research before discussing social distancing behaviours and proposing three categories, before exploring role-taking and pro-sociality and some summary points. These images might be familiar to those of us following the COVID-19 pandemic in Australia. This was the 20th of March. On a hot early autumn weekend, there was public outcry at packed beaches. Young adults were characterised as selfish, uncaring, and not following COVID prevention advice. This stayed with me as the pandemic progressed and made me think, how are young adults experiencing the pandemic? Are they following the rules? And is their behaviour selfish and uncaring? I wanted to explore lived experience, so I decided to ask adults 18 to 29 a series of 6 open-ended questions in a reflexive format designed to minimise the potential for psychological distress. In all, I conducted 28 interviews via Zoom from early June onwards. Sampling was primarily purposive and snowball from existing networks at the ANU and University of Technology, Sydney. Also some convenient sampling through those university social media platforms. The study limitations include sample bias being made up of university students or alumni, social desirability bias, and temporality, with the pandemic rapidly evolving during that period of time. Despite these challenges, I feel that the richness of the data provides some interesting insights. So as I go through the presentation, I'll share some quotes from the interviews. These have been de-identified using generic numbers for confidentiality purpose. So for the people I spoke to, transitioning to this new reality was definitely challenging. As study work and social lives moved online or stopped altogether, whilst most were eventually able to develop a new routine, this came at a significant cost. Almost everyone reported significant increases in anxiety or other mental health issues, including negative effects from a dislocation from social circles and wider society, including loss of energy, lack of purpose, and so on. This brings me to social distancing. This is an umbrella term I've used to capture positive personal actions to prevent the spread of COVID-19. I asked participants about their approach and their motivations and some of the things that may have influenced them. I analysed behaviours and motivations, and what I found was a situation more nuanced than the dichotomies often suggested in recent publications. Some of the examples of those include Murphy and colleagues and Prosser and colleagues. Those details at the back of the presentation. What I found was a majority of people falling in a middle ground here. You'll see the data trends towards a pro-social quadrant. I believe this is partially down to the fact that I spoke to mostly student leaders as part of the study, but also reflects the increases in social cohesion reported during the early part of the pandemic. And this was captured by the ANU poll released in early May, with trust and the behaviours of others being central components. And so I found 3 categories of behaviours, which I've called protectors, survivors, and rebels. For many, these are new social identities that formed during the pandemic, seemingly from a range of factors, including personal values, social influence, societal norms, and more. In many cases, these identities were a means of connection during the height of the pandemic. And this is a factor discussed by Jedden and colleagues in their interesting book, Together Apart. For our first group, protectors, they took on protection of others to extremes, embodying exemplar behaviour often beyond government guidelines. They were highly motivated for others despite significant personal costs. Protectors reported feeling a high level of emotional and cognitive connection to vulnerable people in their family and across society. For the majority group, survivors, this identity evolved through a series of symbolic interactions negotiated between friends, family, and social norms. They demonstrated large amounts of concern for vulnerable populations, although many of them created their own rules of behaviour with minor rule breaking to mitigate social and psychological impacts of isolation. The final group I've called rebels. This identity is characterised by a mistrust in public information relating to the pandemic and a perception that social and economic costs are equal to or outweigh the health risks. Although all respondents reported some level of pro-social behaviour and concern for vulnerable populations, for rebels this was countered by a need for independence. These identities were not static, and I found movement within these categories and even between categories during the first part of the pandemic. You can read these examples later if you wish. I wanted to understand more about the foundations of pro-social behaviours and, was there a feeling of engagement with others, and if so, who and why? Jenny Davis and Tony Love explained the concept of role-taking as a sociological process of which emotional empathy and perspective taking are component parts, reflecting the structures that exist in society. I get a sense that for protectors and somewhat survivors, their reduced risk of mortality from COVID-19 and pro-social values provided a sense of agency, which shifted their status and power within their family, friendship, and community structures, enabling significant role-taking. Within the study, I found 75% of all respondents experienced role-taking with close friends and family, while 60% gave an indication that role-taking existed beyond those closer social circles. But why such a high level of role-taking beyond close social circles? This is where I found many comments relating to intergroup relations. One possible explanation comes from the ideas of Sikara, Brunio, and Sachs. In the initial months of the pandemic, people shared experiences of social isolation, which perhaps created a new in-group or at least enlarged in-groups. As antisocial behaviour received more attention, such as hoarding and racism, for some people, these new in-groups perhaps dissolved or weakened and were replaced by perceived group threats. I found survivors were most likely to be affected by their perceptions of others' behaviours. So in summary, I found 3 social identities from social distancing behaviours, forged through tensions and trade-offs, while pro-social behaviours seem to be supported by role-taking. Moving forward, there are implications if we face future waves of the pandemic and how we might encourage greater pro-social behaviours from young adults. Beyond that, I wonder if these new identities will be maintained in a post-pandemic world, especially for protectors who seem to have embodied their new responsibility. Lastly, I wonder if role-taking across society could be explored further and potentially applied to other systemic issues. Here are the references I've referred if you'd like to explore more. Thanks for listening. I hope you found this interesting. Please feel free to get in touch to discuss more.